Hi, it's Patrick Hutzel again here from intensivecarehotline.com, where we answer your questions. In this week's episode, Sandra from New York, from the United States, writes in: "We have been told that my aunt has gone into severe lung failure. The doctors and nurses have told us that she's not expected to survive. 1 month at the maximum. The ICU team has been talking about intubation. I think a tracheostomy will be easier, as it would likely help her to be ventilated. What would you advise?" Hi Sandra, thank you for asking this question. Without knowing the full circumstances, people's most likely and most intuitive response is to paint the worst possible picture. It's also intuitive to follow the advice of the doctors and the nurses in the intensive care unit. Because you are not an intensive care insider, you would find it hard to believe that even though your auntie's situation appears to be very difficult, if not hopeless from the outside, to the point where you think that she's going to die soon, you have to think about the perspective of the doctors and the nurses in intensive care as a starting point. Even though most of the health professionals working in intensive care are optimists, otherwise they couldn't do what they are doing, they also tend to be very careful of what they say to families of critically ill people in order to not give you false hope and also to protect their professional reputation. The reality is that even for doctors and for nurses who have worked in intensive care for many years, it's difficult to exactly predict the most likely outcome of your auntie's stay in intensive care. The reality also is that the trajectory of any patient in intensive care is often hard to predict, and doctors and nurses in intensive care have usually seen a wide variety of cases, with good cases turning bad and bad cases coming good. If your auntie's lungs are failing, she might have ARDS or acute lung failure, and she certainly would need intubation as a starting point. Depending on the severity of the lung failure, she might require ECMO, and she would well require a tracheostomy. This is hard to say, since I don't know the exact details and circumstances of your auntie's history, but these are some of the most likely and common scenarios. I think what's really important for you and for your family is that you are not giving up hope. Ask plenty of questions and don't be afraid to ask such questions that if the intensive care team thinks that your auntie is not going to survive, whether that's based on clinical facts or just based on the negative mindset of the health professionals you are dealing with. It's critical for you and for your family to stay positive. Your auntie can feel you and your family giving positive vibes. Also, find out and ask whether the intensive care unit has other patients waiting for admission to intensive care, and therefore they have a high demand on ICU beds. With the ICU experiencing a high demand on beds, they may put a more negative spin on your auntie's prognosis, and they may not tell you the whole truth of what's really going on behind the scenes. Furthermore, you might want to also ask if the intensive care team is wondering that if your auntie's treatment and recovery is prolonged, that it may cost too much and that it may stretch the budget in the intensive care unit, or that it may stretch your budget. I hope that helps, Sandra, and thank you for asking that question. Send us your questions to support@intensivecarehotline.com and I'll answer your question as well. You should also read our free Instant Impact Report. In this free Instant Impact Report, you get a ton of information of what's happening in intensive care behind the scenes that is impacting on your auntie's treatment that you're unaware of. In the Instant Impact Report, I'll teach you immediately how you can take control, have real power, and influence decision making, no matter how challenged, frustrated, or vulnerable you, your family, and your critically ill loved one in intensive care feel. You will also, with the free Instant Impact Report, you will also get 4 other more free reports. The other 4 reports are 6 questions you need to ask the most senior doctor in intensive care, 7 answers to the 7 most frequently asked questions if your loved one is critically ill in intensive care, 10 things doctors and nurses are talking about if your loved one is critically ill in intensive care, and 9 myths of being a critically ill patient in intensive care. Thank you again for watching this week's episode, and I'll see you again next week with another question answered. Thank you.